Hi, how are you going? I hope you're feeling as well as possible on your medicines. I'm Pharmacist Fi. Welcome to video number 1 of our first medicine safety series called 7 Things You Can Do. Today, we're looking at why everyone who takes medicines should make a medicines, allergies and contacts list with their doctor and pharmacist and keep it updated and take it with you everywhere you go. In the description below or on the webpage pharmacistsfi.com, that's right, isn't it, Denver? Good boy. You can find a link to download a Pharmacist Fi Medicines, Allergies and Contacts List PDF form, which you're welcome to use to create your very own medicines, allergies and contacts list. Yay! In this video, we're going to look at why you should keep your medicines, allergies and contacts list with you all the time in case of emergencies, and especially each time you go to a doctor or pharmacy, so your doctor or pharmacist can help update your list if there are any changes. And we will also show you how to use your list before you leave the pharmacy each time to check the medicines you are collecting and their labels and containers are an exact match of what is on your medicines list. And I highly recommend that you regularly read your medicines, allergies and contacts list just before you take your medicines to remind you exactly how much to take, when to take and how to take each of your medicines. And never cut, crush or chew any tablets or open any capsules unless a pharmacist or CMI has told you it is safe to do that. Right now, are you wondering what a CMI is? If so, a CMI is Consumer Medicines Information, and every registered medicine in Australia has one. So make sure you also watch video 2 to find out why you really need to get a CMI for each of your medicines. But back to your medicines, allergies and contacts list, I highly recommend that every time you see a doctor, including specialists, you ask them to help you update your medicines, allergies and contacts list during the appointment with what medical condition you're taking each medicine for and what each medicine's active ingredient is. Right now, are you wondering what an active ingredient is? Well, wonder no longer. It's the ingredient in your medicine which does what the medicine is supposed to do. And a lot of people don't realise that although most medicines have a range of ingredients, usually only 1 or 2 of those ingredients are active ingredients. And if you know your active ingredients, that is key to knowing whether you have 2 completely different medicines or 2 different brands of the same medicine, which can be very important for medicine safety. Because if you don't know that you have 2 brands of the same medicine, you could accidentally take a dose from each. And double dosing some medicines might increase side effects or even make you very unwell. So that is why knowing about active ingredients is great, because it might help you prevent accidentally double dosing a medicine. Right, now back to our medicines list. Also ask the doctor to help you write in whether they have a preferred brand, plus how to take, when to take and how much to take of each of your prescribed medicines. And make an agreement with your doctor about how, when and how much you take of anything that doesn't need a prescription, if you take any of those things, such as medicines from the pharmacy or supermarket, or vitamins, minerals, supplements, herbal medicines, and also non-medical drugs like caffeine, alcohol or smoking. And put all of these things in your medicine list too, because quite a few of these products which don't need a prescription, plus the 3 non-medicine products I just mentioned, any of these may interact with some prescription medicines. And they may also affect which blood tests your doctor needs to advise you to have. I also highly recommend you update your medicines list by asking your pharmacist to help you write in for each medicine the current brand name and any interactions to avoid. And if there are any interactions between any of the things you're currently taking, or with foods and drinks, for example, grapefruit, Are they likely to be serious enough for you to possibly need changes to medicines or other products, like what we just talked about, or not? If changes are likely to be needed, how quickly should you see a doctor so you can ask the doctor exactly how to make the changes as safely as possible? For example, should the pharmacist call your doctor for you immediately, or can it wait a day or two until you can contact the doctor yourself? Ask your pharmacist all of these things. And also ask the pharmacist to help you write in any uncommon but dangerous side effects to watch out for, and what to do if a dangerous side effect did happen, like whether to go to the nearest hospital emergency department or whether it can wait until your next doctor's appointment. Plus, ask the pharmacist to help you add to your list the most common side effects of each medicine and whether side effects decrease with time, and if so, how long should that take? For example, the first day we take blood pressure medicines, they often cause dizziness or a lightheaded faint feeling, but not actual fainting. But if they are taken every day, that dizzy or lightheaded feeling should decrease and not be noticeable after the first day or two. But if blood pressure medicines are only taken occasionally, these side effects are likely to happen every time they're taken. This is one of many reasons blood pressure medicines should always be taken consistently, not just occasionally. And always ask your pharmacist what common side effects are for your medicines, how long they should last, and what to do about them if you get them. Plus, reading your CMI for each medicine, which we'll look at in video 2 of this series, is very handy for finding out what to do about side effects. Finally, each time you collect your medicines before you leave the pharmacy, always check if your medicine containers and labels both match your medicines, allergies and contacts list on how to take, when to take and how much to take each medicine. And if anything looks different, for example, if any of the medicines don't have your name on them, or if the medicine name or medicine strength is different, and by the way, medicine strength is how much active ingredient is in a measured amount of the medicine, like in a tablet or in a capsule, or per mil of a liquid or per 5 ml of a liquid, those sort of things. If anything is different, ask the pharmacist to check it. And if the difference was because of the prescription, in Australia, the pharmacist can even call the doctor for you to find out, if you like, whether the difference was on purpose or an accident. Thankfully, mistakes by doctors and pharmacists are not common, but human error does occasionally happen. So always check your medicines match your medicines list before you leave the pharmacy. Because in this era of patient-centered care, which you can find out about in video 7 of this series, we need to take responsibility for our own health. And one of the key ways we can do this is to do our best to make sure you get the right dose of the right medicine, the right way, at the right time, every time. Another great thing to do with your medicines, allergies and contacts list is to keep a copy of your list with you all the time, in case you ever have an accident, so ambulance or hospital staff could read your list to help them avoid giving you medicines in the allergies section of your list and avoid giving you medicines that interact with your regular medicines or medical conditions. And if it's appropriate, hospital doctors can keep giving you your regular medicine list medicines while you're in hospital, which might be very important depending on what types of medicines you take. Because if some types of medicines are stopped suddenly, for example, beta blockers, they may cause dangerous rebound effects like high blood pressure. Or some other types of medicines may cause miserable withdrawal symptoms like anxiety, sweating, or diarrhea from stopping opioids. And who wants to have those kind of problems, as well as the emergency accident or illness that already put you in hospital? Plus, your medicines, allergies and contacts list also helps hospital doctors contact your main doctor, specialists, pharmacists, or next of kin emergency contact people if they have any questions about your medicines or allergies that you are unable to answer. For example, if you're unconscious or unsure. So this is why you should always keep your medicines, allergies and contacts list with you everywhere you go. And also consider giving a copy of your list to your doctor, pharmacist and any next of kin emergency contact people. There are great free apps now available for helping you make a medicines list, like the NPS MedicineWise app. And you can find a link to the NPS MedicineWise app in the description below or on the pharmacistfi.com website. Or alternatively, some pharmacies have their own apps for customers. And any of these apps are brilliant for helping you to keep your list updated with the doctor and pharmacist, and helping you to check your list just before you take your medicines so you can take them more safely. But if your mobile phone needs you to unlock it, if you're unconscious or just too unwell to deal with a phone in an emergency, these apps will be useless for ambulance or hospital staff trying to access your important information. So I highly recommend also keeping a paper copy of your medicines, allergies and contacts list with you all the time. So my top tips from this video are: make a medicines, allergies and contacts list and keep it updated with help from your doctors and pharmacists, and keep it with you all the time, both in case of an emergency and especially every time you go to a doctor or pharmacy. And check if both your medicine labels and your medicine containers match the instructions on your medicines list, and all medicine labels have your name on them before you leave the pharmacy. Plus, regularly check your medicines list just before you take your medicines to make sure you take them as well as you can. And if you ever find that even with your medicines, allergies and contacts list, you still have trouble taking your medicines because of difficulty swallowing, or difficulty opening medicine containers, or difficulty reading medicine labels or your medicines list, or difficulty remembering how to use your medicines list, chat with your doctor and pharmacist as soon as you can, because there are a range of good options to help you, which your doctor and pharmacist will be happy to tell you about, and can even help organise for you if you like. Please subscribe and like this Pharmacist Fi YouTube page and visit us regularly, because we're putting up at least 2 medicine safety videos a week. Denver and I look forward to catching up with you again very soon. Thanks for watching. Bye. Oh,